Hey y'all, welcome to the Unleashed Performance Therapy Podcast. I'm here with my co-host Robert McNair. Our guest on the show today is Doctor of Physical Therapy, a Doctor of Physical Therapy out of Lubbock, Texas, Dr. John Richards. John, how's it going this evening?
It's going well. It's going well. Thank y'all for having me.
Yeah, absolutely, man. So me and John worked together at an outpatient orthopedics clinic out in Lubbock for just about 2 years, and I was messaging him today, and after finding out that he made the transition to home health. And I said, I got to have you on, man. You want to hop on the podcast and tell us a little bit more about it. So, John, let's just jump right out there and say, why the switch to home health from outpatient?
Honestly, it was about a 3 to 6 month process of just debating what I wanted to do because, we can maybe get into this a little later, but my heart's always going to be outpatient orthopedics. I love outpatient orthopedics and I love everything that goes with it and manual therapy and all that. But it's just the reality of outpatient orthopedics, especially in a insurance type clinic, is hard. The pay is not necessarily there, which is just it's great pay. I'm not trying to sit here and complain about the pay, but for what we're supposed to do and the people that we're supposed to see towards the end, I was seeing probably about 15 to 16 people a day, and that's just on my schedule. That's not stepping over to do reevaluations or speak with
Mm-hmm.
patients about certain symptoms and things they're experiencing or taking phone calls from physicians. And I just wanted a little slower paced and a little bit more one on one with my patients. Also, being in the clinic, you're tied to clinic hours as well. You're especially if you want benefits, you're there full time, 40 hours a week. And no matter how you spin it, it's either 8 to 5, 9 to 6, 7 to 4. And so I wanted a little bit more flexibility within my schedule, and that's one of the reasons why I picked home health. And it's been nice. I mean, as I said, we'll talk more about it later, but it's been nice, and that was really the big thing, and also the pay. We can't kind of
Mm-hmm.
leave out that. The pay is better.
Of course. Of
Um,
course.
but I really just made the switch a lot more for just a little bit of a slower pace, lower caseload, and the flexibility of it.
And there was kind of three things that stuck out. There was the flexibility, the pace, having the patients on your caseload, and then the money. And it sucks that right now in our field that we have to deal with the outpatient in the outpatient realm. You're having to see so many patients in order to make enough money with this insurance based model, because they're continuously cutting down the reimbursement rates, and so that just means you have to see more and more in order for the clinic to make the money that they need. Of course, the flexibility is a big one as well. Because coming, you've got a family, you want to spend more time with them. Home health is one of those things that provides you with the flexibility to do a lot of different things.
Yeah, exactly. I mean, I think you worked with Nick. Nick was one of the physical therapists at McCombs and Associates for a while, and I kind of sat down there and talked with him about his future, what he thought, and what he wanted to do. And his biggest thing was physical therapy was his job, but that was not his drive in life. His drive in life was his family. And as I've kind of gotten older, and Finley's gotten older, my daughter, and that she's starting school here soon, kind of a goal of mine's always been able to take her to school and pick her up from school and all that. So, my focus has shifted a little bit, as I said, as I've kind of aged and as she's gotten older and getting into more gymnastics and sports and all that. I want to be a part of those things.
The exciting stuff.
Yeah, man, it's a lot of fun, and with the clinics, with the outpatient clinics, I can't be mad at them. I can't be upset, and because that's just the reality of it. People need physical therapy. People are hurting themselves. People are having surgery. More and more insurances are denying people certain treatments and interventions until they have physical therapy, which, I mean, I'm a little biased, but I mean, I do believe in physical therapy. I can think it can help a lot of people. I think too, more and more physicians or providers, not necessarily physicians, but nurse practitioners, physician assistants, especially the younger ones, are believing more and more in physical therapy and more in conservative treatments. And I think we're seeing that surgery is not necessarily always the answer. And so I think that that's the game too of, people need to be seen, and these clinics are just trying to keep up with the employees that they have, or the therapists that they have. And it's also still a relationship between the clinics and the physicians too. If
Mm-hmm.
physicians are sending patients to clinics and they can't see them for 2-3 weeks, they're not going to send them there anymore just because they're not seeing their patients. And so I think that's a little bit of a game as well, and a little bit of the reason why you are seeing this influx and this overcrowding and overbooking of outpatient clinics.
For any area that says that they're saturated, I mean, there's plenty of patients to go around. There's no shortage whatsoever. So I know we touched on flexibility, money, and just caseload in general. But other than those three things, what are some, now that you're in the home health field, what are some likes, dislikes, some advantages and disadvantages other than those three things that you found working in the home health field?
I mean, I think some of the likes, I mean, I touched on those three. Other than those three, I feel like I do enjoy kind of a break in between my patients, my clients. That's kind of nice. I mean,
Okay.
I can, it may be a 10 to 15-minute drive between patients. It could be a 45 minute to an hour drive between patients. I've been to Lamesa, Tahoka, Anton. It's the first time I ever went to
Oh,
Anton. Yeah.
nice.
Littlefield, I've been all the way out to Seminole. And so I like that aspect of it too. I feel like it's a love hate with that. It's
Hmm.
it's nice because you get to drive, you get to kind of clear your mind, you get to think about your next patient or about the last patient, and kind of you know do some clinical reasoning or figure out what you want to do with that person that you're about to see. As I said, but also sometimes it's a drawback because I may see, at a 6 hour day, I may see 4 people or 5 people, but most of the time I'm driving.
Yeah.
And so, with the driving, that's kind of a love hate relationship with that. Also, kind of one of the benefits is, same thing, a love hate relationship with it. One of the things I like is it gets me out of my comfort zone a little bit. I was outpatient
Uh-huh.
orthopedics for 3 years, and I felt like I had a pretty solid grasp, because that's what I was doing. That's what I did all my continuing education in: dry needling, cupping, my manual therapy certifications. But now it's going back into that PT school mindset of, these person has these lab values, or has these wounds, or has these drains. What do I need to do with them? How do I need to manipulate my environment to achieve what I need to in treatment? And same thing as being in their home. You know, some people don't really like the homes in home health. I don't mind them. You know, there's some nice houses and some less than favorable houses.
That's the nicest way to put it.
Less than favorable, and but these individuals still need help, and so I do my best to help them.
Mm,
With some people have a wide open space to where we can walk 40, 50 feet, and do laps. Some people have 10 feet up and down the hallway, and that's all they have, and so we got to work with that. Getting back to my transfer skills, I lost some of those because, I mean, we hardly transfer people in the clinic. That's just not
mm-hmm.
what we do. A lot of people are ambulatory when they come into the clinic, and so we really have no issues with that. So I've enjoyed that a little bit, of just going back to my foundational base knowledge of physical therapy and being able to use that. Like, the things I don't like is, back to, it's not orthopedics. As I said, that's my jam,
Yeah.
love, um and it's, trying to say this without sounding bad. It's not necessarily my it's not necessarily my clientele that I would like to eventually start seeing. I would like to see, like, more younger
Mm-hmm.
adults, active individuals. These individuals are Medicare, and, like, Medicare insurances, Medicaid, things like that. So they're typically a lot older, and have a lot more comorbidities, things like that. I don't see a lot of joints. We see maybe a couple knee replacements, couple shoulder replacements. That's about it. And I think one thing I don't like, one of the things I dislike is when you talk about like say SNFs and inpatient rehabs, a SNF is a skilled nursing facility, right? I mean, it's more focused on nursing. There's rehab there, but it's more focused on nursing. Inpatient rehabs are more focused on PT, outpatients more focused on PT. Home health, I feel like is a little bit more closer to a SNF. That's a lot more focused on nursing because a lot of our patients have wounds or they have catheters that need to be
Mm-hmm.
changed or they have medication issues they need to be monitored, they have UTIs, things like that. And so I feel that it's a little bit more nursing focused rather than therapy. A lot of therapy is okay, let's get up, let's walk, let's do some standing hip abduction, some kick out, some heel like toe raises, doing those agility ladders and all that stuff. So I
Yeah.
do miss that. So, but I
You
would,
could probably
I
throw
would,
some agility ladders in there.
yeah, yeah. And then just, home health documentation, man. I mean, I'll never complain about outpatient documentation ever again.
Oh, really?
Yeah, ever again, man. Because, well, I was, my mind works a little bit differently. I feel like, when people ask me, it's like, was physical therapy school hard? And when I think about hard, I think of like physically hard. Like, PT school wasn't necessarily very hard. It was a lot. There's a lot of volume. Same thing with home health documentation. Like it's not hard. It's very in depth and it's very inpatient-y. It's like what's their
A
bed.
lot of buttons that you got to click.
Yep, exactly. Cardiovascular screening, integumentary screening, respiratory screening. You have to do cognition about evaluations, dementia, things like that. And so it's more in depth and it's more button pushing and just takes longer.
Yeah, just like most PT students, you kind of gravitate towards that ortho first. That's like your first love. I've been a tech for forever, and I was at a private ortho clinic, and now I'm at a neuro clinic, and I want to get back to that ortho. But I talk to people like you and home health. I'm getting married next year. I'm sure we're starting a family soon, so the home health is always there on the table. And I mean, it's the flexibility, I think, is one of the biggest pluses for a lot of people because you kind of get
Mm-hmm.
to make that schedule for yourself. In regards to that, with your now, I believe you are working with a home health like agency,
Yes, sir.
right?
Yeah.
So is it more of like you kind of show them, hey, this is where I'm able to comfortably travel, or is it like they kind of have a list of patients and you kind of just select through those patients and go there?
So yeah, so good question. Well, so when going into the company that I work for, we have a certain area of coverage. With being in
Okay,
West Texas, it's kind of big just because, we have a lot of little surrounding areas. We have Littlefield, we have Levelland, and we have Lamesa, Tahoka, things like that. Places that don't maybe necessarily have like clinics there that, and so that's kind of like our area of coverage. And for my company, we have three physical therapists, including me, and they just kind of told me we're going to split the area into thirds. And I asked if because I live on like the southeast of Lubbock, which is towards like Tahoka and Lamesa and Slayton. And so I did ask my supervisor. I was like, "Hey, I know I'm new here, but if I could put my hat in the ring of can I have like Southeast Lubbock to where I can just leave my house and Slayton is like 15 minutes away from me, but say Little or Levelland, which is
Opposite direction.
northwest, it takes me 45 minutes to get there, and so divide us up into like our little territories. And we also have
gotcha.
three PTAs that work with us as well, and so PTs mostly. So how home health works, of course, it's the same thing as like outpatient. You have different types of visits. You have evaluations, you have starter cares, you have routine visits, you have recertifications, and so PTs will mostly do those PT scope of practice visits, and then PTAs will do like the routine visits. And
Hmm.
so that's kind of how they divvy them up. And I have a PTA that mostly sees my patients. So
Okay.
And it would just depend on your area. I have a buddy that lives in the San Antonio area that works for the same company, and they kind of do the same thing of they divvy them up into areas of, hey, this is your section. That's not saying that you'll never get anybody outside of your section, but mostly I stick to my area. So it's not too bad. I mean, there's still some days I drive 100, 150 miles. I'm in the car a lot, but there's also some days I drive 20 or 30 miles. So it's not too bad.
Right. Gotcha.
Would you say that you've become a little bit more versatile in your practice?
I would say I have. I mean, as I said, I had to dust the webs off of some skills for sure. Going into home health, though, too, this is kind of my advice for anybody that wants to do home health. You know, have a little bit of experience first. When I applied to my job on the job application, it asked for at least 9 months of experience.
Oh, wow.
Just because there's an orientation period, which you work with a PT, PTA, whoever. You follow them. They do a few visits, you watch them. You do a few visits, they watch you, and that's pretty much it.
Do you feel like that was excessive, or do you feel like it was a good amount of time that you needed to, or did you even do the 9 months?
Well, no, like 9 months of a work experience, like up to, and so just like 9 months of experience as a therapist. Like you have to
Oh,
be
okay. I thought
licensed.
you
Yeah,
meant just like in a home health setting. I was
Oh, I
like, that's
thought,
kind
yeah.
of
It's like, man.
being licensed therapist for 9 months,
okay.
I got
because
you. Got you.
I wouldn't say cut loose. I mean, they do what they can. They train you. Hey, therapy's
Hmm.
therapy, no matter what realm you go into.
You
We
basically have to learn the EMR.
EMR, like how to
Yeah.
add medications if they have any medication issues. A lot of times, with home health too, actually another thing that I don't like very much is there's a lot of times we have to call the physician for certain things. If they have any vital signs that are out of parameters, we have to call the physician. If they've fallen, we have to call the physician. That's if they fall while we're there or not there, we have to call the physician.
Oh, man.
Some medication reactions, we have to call the physician. For
Oh, wow.
any add-ons for evaluation, we have to call them, get a plan of care approval, and so it's just communication, which I think is great. I think is great to make sure to kind of keep them updated. A lot of times I'm just leaving voicemails anyway. It kind of takes away a little bit of our clinical reasoning though that we learned in school. So it is what it is, and I try to do my best to get the job done correctly and ethically. So
Fair enough. And so you kind of alluded to it already. So you said that any advice you'd have for anybody going into home health is to have some experience before going in. Is there any advice you would give to students or new grads? Maybe the student is going to do a clinical rotation in a home health setting, or the new grad really, like, that's their only option that they have is jumping into home health for whatever reason it is. What kind of advice would you give them for being in that setting?
yeah, I mean, as I said, if you can definitely get some experience first, because I that was one of those little bit of I wouldn't say culture shock for me, but something that was different, because being in the clinic, we have PTs that are there, we have PTAs that are there, we have PTs that have been practicing a little longer than us, and so we can always bounce things off of each other. And I'm sure there was a couple times me and you were sitting at the desk and we just throw ideas back and forth.
Mm-hmm.
And with home health, you're on your own for the most part. You're out, you're walking into a house, you're by yourself. You can call, like I can call the other PTs, but they may be in a house, I may or may not answer. I can call my supervisors, which they can help me when it comes to like the EMR and the home health things, but my supervisors are nurses, and so they don't necessarily know like the scope of practice with physical therapy. And I can't ask them about a certain joint question or joint problem.
Yeah, that's interesting.
Yeah, and so doing that, being open-minded, going and going into these people's houses, and also being polite too, I think is a big thing. Is because with people coming into the clinic, it's a difference between you're going into their home too. And so
Yeah.
being polite and respecting that as well. I try to every time I leave, hey, thank you for having me in your home, and we'll be in contact, and just kind of have a good grasp on those foundational skills is really what it is. I mean, there's nothing really
Hmm.
too advanced that happens in home health. I would say that's probably the advice I have is just, as I say, go in there open minded.
Did you have any pediatric patients?
No, I do not. Like the only child I
Yeah.
can deal with is my own.
Yeah, I never just the way you just put that just now, never really thought of it as, I mean, you're basically going into that person's literal their personal space, and I can imagine the different mindset not only you have going in, but the patient allowing you to come into their house and help them. And I'm sure there's a whole another level of gratitude and stuff that patients have for home health therapists.
And I feel like
So
sometimes people don't even want you to be there either, right?
That was, I mean, that was when I was going into physical therapy school. I wanted to do acute care physical therapy. That's what I thought I wanted to do because the clinics I shadowed at were just kind of those, ortho mills, just cranking
Hmm.
people out. And when I shadowed at the hospital, is that one-on-one treatment, that more personalized treatment, and I thought that's what I wanted to do. And when I went into PT school and kind of realized this is nothing against acute care PTs, we need them, but realized kind of what it was getting people up, getting people walking, and are they safe to go home? If not, where do they need to go, and what do they need? And for me, that was
Hmm.
not as fascinating or interesting as manual therapy,
Someone further
orthopedic
along the
therapy,
road.
things like that. Yeah,
Yeah, a little bit further down in the recovery.
and that's kind of the. I mean, as I said, I'm not gonna lie, it's not been all rainbows, the transition. I mean, that's kind of the internal battle that I'm having with myself right now. After it's only been 3 months, but it's that, as I say, kind of that
Yeah.
acute care of get them up, get them moving. Are they
Hmm.
safe? What equipment do they need? Versus, as I said, that little higher end of orthopedics manual therapy.
Yeah, and it brings up the term. It's a kind of a buzzword now, but the burnout that you feel a lot of PTs are feeling, and in the outpatient ortho setting, you're feeling that burnout because you're seeing so many patients in such a short amount of time. You feel like you don't really have a time to breathe, and then in a setting like home health, I feel like you get that burnout feeling because you are not working with someone as high level as you'd like to be working with. And just seeing that kind of patient over and over and over and over, that's where the burnout starts to come into play.
I think that's a great way that you put that, and that's true. And so I just, that's kind of that fight, that battle that I'm having with myself right now of, I enjoy the flexibility, I enjoy the pay, and I enjoy the reduction in
Hmm.
caseload and the breathing room. But, I miss, as I said, I miss that outpatient orthopedics, that manual therapy. I mean, that's where my heart's at. And, right now
Yeah.
it's, my passion. Do I do my passion, which is 40 hours a week, 15, 16 people a day, just moving through them, or this to where I get more time with my family, and I
Hmm.
get more time for myself as well. That's a big thing, working out, staying active.
But
And
who's to say there's not something in the middle, right?
that's
All right, getting that fix.
that's kind of I'm looking into that right now. That's kind of my mountaintop, my end goal is trying to find
Yeah.
a middle ground. So
Yeah. So let's dive into that end goal. What's
so
what do you have in mind?
the reason, switching to home health, of course, was the pay because, we all have debts, America,
Hmm.
right? We
That's
all have
important.
debts. Yeah, we all have debts. And so
How
um,
much is it? Yeah.
my goals is to just take a huge chunk out of my debt and not have to be tied to, money makes the world go round, of course. I don't want to be tied to a paycheck or to a job where, like, well, I need to take this job because it pays more. I need to take that job. I would love to get into a setting or into an area that I love to do and it's my passion. I mean, of course, you're not going to have, out of 100 days, you're not going to have 100 amazing, I want to go to work days, but I would like to have more great days than bad days. And so
Mm-hmm.
that's my goal for now, is to kind of start just paying off and getting to a point to where I can step back and really look at what I want to do, and also kind of see how I don't know if culture is a great word for it, but just how the profession changes. In Lubbock, we're
It's
seeing a lot
always
more
changing.
clinics. Yeah, Lubbock, we're seeing a lot more clinics open up, and it's not just those few monopoly clinics that have been here for a long time. Those are still cranking out patients, but we're seeing a lot more clinics open up, and we're also seeing a shift into more cash pay physical therapy, which I do feel like is going to be the future of physical therapy, and potentially, I mean, even medicine to an extent. I feel like, insurance runs the world, and there's a lot of
Yeah.
times that we get frustrated at it, that patients need things that are going to improve their progress or improve their rehab, and they just can't get because somebody at a desk says no, you can't get this, or we're not going to pay for that, or for whatever reason. And reimbursements are getting cut. Hey, we're not going to pay you the same if a physical therapy assistant treats you versus a physical therapist, which I don't.
Mm-hmm.
Of course, we have different educations, but I don't. I'll say this to people that just don't know. I don't think you're getting lesser treatment if it comes from an assistant as compared to a physical therapist. I just don't. There's,
I
I
appreciate
know,
that.
yeah, man. Yeah, dude, shout out. I know some phenomenal physical therapy assistants, and I know some
Oh
bad
yeah.
ones too, but I know some great ones. So I know some bad PTs as well, man. But so I think that's kind of or hey, we're not going to, dry needling is a big thing. Insurances don't pay for dry needling. Most insurances don't.
Mm-hmm.
Will, but I think, we're seeing that shift into, cash pay practices. And I would love to, within this next year, I want to look into that, of opening my own business, starting to kind of treat people on the side ethically, with referrals and things like that. Because, Texas, limited direct access are
Mm-hmm.
still very much tied to physicians, which I don't see that changing anytime soon. At least in the next 10, 15 years, I don't see that changing anytime soon. I talked to my professor about it, and he said in his career it probably never change. Maybe in our career it will, but I don't know. But it is what it is. But as I said, kind of going back to what we talked about before, I do think physicians are, believing more and more in physical therapy, and so I think they're okay with, like, hey, let's get you to a physical therapist and see what they can do for you. That's, over the next, I wouldn't say this year. Right now, I'm just trying to get my feet under me with home health and
Mm-hmm.
get a things kind of paid off or paid down, and look into first steps, right? Malpractice insurance, looking into like making myself an LLC, and then also then start to kind of work and get a little bit of a caseload on the side.
Yes, sir.
Looking to treat more like athletes and active adults, kind of thing.
Mm-hmm.
The sexy area of PT, right? Treating those athletes. Everybody wants to treat
That's
athletes,
it.
man.
Mm-hmm.
Everybody wants to, yeah.
That's a lot of what you said. I resonate with a lot of what you said, because I kind of stepped away from that outpatient ortho clinic as well and jumped into the sniff world because of the flexibility, because of the money, and it's been okay. I don't hate it at all. It's easy. I have a really good relationship with a lot of my patients. Everybody gets treated well. My coworkers are phenomenal. I just feel like I don't. My heart is in that outpatient ortho world, and that's where I want to be, and that's where I'll end up. And right now, I'm kind of in this world right now because that's where I need to be for me and for my family. But in the future, I'd like to. I mean, after I graduate from PT school, start my own thing too,
Yeah.
and that's kind of where I resonate with where you are as well.
Yeah. I mean, I depending on how you believe, I mean, I do believe everything happens for a reason, and we're all kind of on these paths. And so, kind of as with you, I enjoy it. Like, I don't hate it, but is it what I see myself doing in the end?
Mm-hmm.
But I do believe that, I made the move, made the switch for a reason, and there's been some great things that have came out of the last few months, and so I'm just gonna still see where this ride takes me. And I mean, I think one of the biggest things that I miss about the clinic is just the people too. A professor told me, Dr. Nathan Burgess, one of our professors at Texas Tech, school, he said, work somewhere for the people that you work with and not the patients, because the patients
Mm-hmm.
will come and go. You'll see them for 6, 8 weeks, 12 weeks, 6 months, whatever, but they'll eventually go. But those people you work with every single day. And I think that, because there's bad days in the clinic. It's just what it is, whether it's some issues with, kind of back and forth with patients, or, maybe, I had some days that I couldn't fix something. So, I'm a fixer, and that's just what maybe that's
Yeah.
why one of the reasons why I
We
became
all
a
are,
PT.
man. We
Yeah.
just we want to be able to fix
I'm
somebody.
a fixer, man, and it would break my heart. And even if they weren't good people, it'd still break my heart. But those real good, just those just dang good people that you
Mm-hmm.
just did everything that you could to the extent of your knowledge, your psychomotor skills, and they're still in pain, and there's nothing you can do for them. And those days, those kind of took a piece of me somewhat. And so, and being able to kind of balance that out with the people that you work with, I think is great. With home health, I really don't have that
Yeah.
myself. And I think that was a big change, because you go from an environment that was like stressful and just something going on, high stimulating, just something going on all the time, people coming up to talk to you, techs, assistants, front desk, you're on the phone, you're talking to your patients, you're stepping over, people want to say hi, to, I'm in my car by myself for like 45 minutes to an hour. And
Listening to Hootie and the Blowfish.
yeah, man. And then, and being by myself a lot too, and kind of dealing with that, and your mind wanders. And so,
Yeah.
that's a topic
Gives you
for
a lot of
another
time to
day.
think about things.
Yeah. As I said, that's
A
a
lot of
I
topic
time to
think
for
think
that
about things.
that would be my biggest I guess adjustment, because I'm one of those people. I gotta talk to everybody. I gotta go see what these people are doing. I gotta laugh and joke with these people. Man, once you like you said, you sit there, your mind starts wandering, and
Yeah.
I can only imagine the adjustment that it took.
Yeah, I
We're
mean,
social creatures.
and I'm still, yeah, I mean, I'm still adjusting to it too. I mean, um, as I said, I consider myself a social butterfly. I felt like being in a clinic 40 hours a week kind of took me away from that, because I just feel like I was talking to almost too many people. I mean, that's our job. We create small talk all day with,
Yeah.
same thing as I said, 20, potentially 20, 25 people, just creating small talk. I used to get dogged on by some of my coworkers because I would tell the same story all week. I mean, because I
All
had
day,
I
yeah.
had no other stories, man. Like,
You
and
got
then
you got to recycle those jokes, man.
and
I can attest to that.
yeah, and it's bad when you tell a story to a patient and they're like, "You told me this on Monday," and I was like, "My bad, dude."
Yeah.
My life's not that interesting.
So, but yeah, I think that was a big adjustment for me. It was just, as I said, I was by myself,
Mm-hmm.
and I still text people I worked with, back and forth, but it's not the same, right? You see them every
Yeah.
single day and chit chat, and you built great memories, and then you moved on, right? A new chapter. So
I'd have to say I get some of my best ideas when I'm on my way to work or when I'm in the shower. I get my best ideas at those two times. I just
yeah,
don't have any money to do anything with those ideas.
yeah, dude. I mean, there it is. I think that's also kind of my big thing too. Is I have these ideas and these things I want to do, but I'm sure a lot of people kind of experience this, but trying to push towards those ideas and
Mm-hmm.
not get not procrastinate, not get lazy, and not kind of falling into that that mundane day after day and
Just
until
going through the motions.
yeah until you retire one day, right? That's the goal.
Yep. And when I graduated PTA school, people said, "What now?" I said, "Oh, now I just work until I die."
Oh yeah,
Yeah.
dude.
A little
That's
hamster
what
wheel.
actually one of my best advices I'll give to any new graduates, man, is take some time off. Like take two,
Oh
three,
yeah.
4 weeks, take time off, take a vacation by yourself with your loved one, with your family. I mean, unless you need to work. Like if you need to work to support your family, we had a newborn at the time, so I needed to work, and so I did a temp license. But take some time, take a vacation, because once you start working, like, congrats, dude, you made it. Like this is it.
That's it.
Like look around, like this is your life till you
Yeah.
retire, man. So you want some time off, you got to take PTO, like.
Yeah.
Uh huh.
But
Oh man. Well, before we wrap it up, man, that last question I have for you, most important one.
yeah,
If you could choose one celebrity to treat, who would it be and why?
I actually, this is probably the question I thought about the most, honestly, out of all the questions. But I don't know. I think this might be like, you can say what you want after this podcast turns off if you want. But I think Channing Tatum, dude, he just seems like a cool dude, just a funny dude, man. I see a lot of
Have you
pictures of.
seen Deadpool Wolverine?
Yeah,
The
dude.
Deadpool Wolverine movie?
Yeah, like he just seems like a cool dude, man. So,
I can see that being a good session. Yeah.
Yeah.
I mean, I see a lot of funny pictures of him and stuff. But as I said, you can say what you want after you turn the cameras off. But yeah, I kind of went back and forth between him and like Ryan Reynolds and stuff like that. I'm a celebrity that just seems like his on-screen persona, or like when he does interviews, that's
Mm-hmm.
how he is in real life. And so
Yeah.
some of these, they always say don't meet your heroes. So,
Yeah.
but
One celebrity that I think is probably the same as the person that he's always acting as. Do you know Jesse Eisenberg?
what movies are you in?
He plays the Facebook movie. He plays Mark Zuckerberg in the Facebook movie.
Oh yeah, I know
He
him.
just seems like such a dick in every character that he plays.
Yeah, yeah,
And
he does.
I feel like that's him. I feel like that's him
Like
in real
him as a
life.
person, yeah.
Like he's
So
too good at it.
I mean, he gets paid to do it now. So if you're good at something, don't do it for free. So
Yeah.
Exactly. Exactly. John, man, I really appreciate you taking the time out of your evening to talk with us, man. I know it was a little bit last minute, so I appreciate you
oh
being
no,
on the show.
Definitely.
it was great. Thank you.
It's
Yeah,
been
man.
over a year at least.
Yeah, dude, it's been a while, man. I mean, I just, you just moved on to bigger and better things, man. I'm proud of you, man. I mean, it takes it. I'll say that about you, dude. That's one thing about you is anytime that you have wanted to do something or had a goal, you always put your mind to it and went to achieve it. And it's no small feat, being a PTA and going back to PT school, and that's a lot of PTAs kind of refuse to do that because they just don't want to go back to school, and which they live their life, and that's fantastic. But you going back and getting that education and getting that degree and getting that license is like just speaks volumes to your
I
character and
appreciate that,
dedication.
man.
Yeah,
I'm trying to
That's
do
great.
what I can with the time I have.
yeah, man.
Crazy sacrifices that Jamie's doing. The short amount of time that I've known him, everything you're
Yeah,
saying, spot on. He's
and
Oh man,
dedicating a lot,
I'm gonna
and
lot of
start
growing that
stuff.
tearing up.
family, dude. Growing that family, dude. So,
I
Yeah.
know it. It's been great. It's been great. I appreciate
but
y'all.
yeah, man. All right.
All right, well, that's going to be it for this episode of the Unleashed Performance Therapy Podcast. If you have anything you want us to talk about on the podcast, shoot us a DM on Instagram at unleashed.tx. And y'all, be sweet to me. Scroll down to the bottom, give me a 5-star review, share the podcast with your family and friends. And until next time, peace.